When I was diagnosed, I was going in just for a routine checkup, getting some blood work done, and my doctor called me about a day later and said, "What are you doing right now? You need to come into the office immediately." And that's always a scary situation. I didn't know what was happening. I didn't know what was wrong. And I walked into the doctor's office as a normal person, and I walked out a type 1 diabetic. Leading up to my diagnosis, I noticed a lot of strange things going on, but my family and I never really put them all together to see what was actually happening. I started losing weight really rapidly. I lost around 45 pounds in about 2 months. I was suffering from pretty severe depression. I had cysts where sugar was trying to exit my body. I was just having a lot of different issues before I was diagnosed.
Type 1 diabetes is typically a juvenile diabetes. It's typically not something that's diagnosed later in life. I was 37 years old when I was diagnosed. The two types of diabetes are very different. For type 1, essentially your pancreas doesn't produce insulin. So your body would still respond to insulin if it had any. Type 2 diabetes is exactly the opposite. Your pancreas is producing all the insulin that it can, and it's still not enough. Without insulin, I don't know how long I would live, but it would probably be months.
My everyday process of being a diabetic is injections every time I eat. So I have a little insulin pen. It's a 10-to-1 ratio, so for every 10 carbs is 1 unit of insulin. Another process that I have to do is checking my blood sugar. When I was first diagnosed, I checked my blood sugar with a normal blood glucose monitor. Basically, you poke your finger and you draw a little bit of blood and you put it next to your meter, and that'll tell you what your blood glucose is. Since then, I have upgraded to a continuous blood glucose monitor, and it will tell me my blood glucose every 5 minutes. And every night before I go to bed, I have to take my long-term insulin, which basically is a different type of insulin that is there to keep me steady throughout the day. So if I eat something, my blood sugar shouldn't spike up because of the long-term insulin.
One of the serious issues that I researched was teenage diabetics who were concerned about their weight would do something that we used to call like flying high. You just stop taking insulin, and maybe your blood glucose rises to 300, where normal would be like between 80 and 100. And anything over about 175, 185 blood glucose level, it starts to affect your tissues. So you can literally, like if you go high like that for a couple of weeks, you will start to see your eyesight deteriorate.
I no longer can just eat whatever I want and feel no guilt about it, because I know eventually it'll start to catch up to me if I ignore what's healthy for my body. Being diagnosed at a young age is kind of a double-edged sword. On the one hand, I'm grateful that I was diagnosed and that I never experienced going into a coma, having to be taken to the hospital, but it also is angering because I feel like a part of my life has been taken away.
It's one of these things. I mean, it's not like you walk in and you're limping. I mean, you look normal, but you might be half of a chocolate chip cookie away from passing out.